Well, hello. It's Bruce Williams again. I'm sheltering in place in Bethesda, Maryland, hopefully making the world a little safer by staying out of it. And I hope the rest of you are too. Let's do gross path challenge number 65 today. Slide number 1 is a bit of a slow pitch. We've seen this lesion before. How about a morphologic diagnosis of cause and maybe another affected organ in this individual? Okay, time's up. We see multifocal areas of hemorrhage, and we've said so many times before, whenever you see hemorrhage, I want you to think about necrosis. Okay, the necrosis is probably not transmural, the hemorrhage and congestion is. But all these red areas probably represent an area of necrotizing enteritis in this dog. We've talked about Williams' rule of red guts number 1, and that is if it's a dog or a cat, you want to think parvovirus. In this case, it's canine parvovirus type 2. Causes a multifocal coalescing, eventually a diffuse necrotizing enteritis. Probably starts in the Peyer's patches, eventually spreads out to involve the mucosa as well. It likes the intestine, and it particularly hits the crypts of the intestine, which makes this such a difficult disease for animals to recover from. They generally don't die of it. They die of septicemia because that denuded mucosa allows all the bacteria and bacterial products essentially get right into the bloodstream. The other thing I love about this particular slide is if you look at the appearance of a lot of this gut, it's sort of dull. It has this ground glass appearance because there's a thin layer of fibrin on top of it. There's a fibrinous serositis, and you see that whenever gut gets inflamed. So the morphologic diagnosis is multifocal coalescing necrohemorrhagic enteritis. The cause is canine parvovirus type 2. There are a couple of canine parvoviruses. Canine parvovirus type 1 is the minute virus of dogs. Doesn't cause much of a lesion. Beautiful inclusions in cryptepithelium, but doesn't cause too much disease. This is canine virus parvovirus type 2. There are a number of types, A, B, and C. B seems to be the most important, but it could be any of those. I asked for another organ that's affected in this animal. And at this point in the animal's life, this virus, which is replication deficient, is looking for cells in a particular stage of division, which it has to infect to continue its life cycle. And at this point, it's only going to affect organs which have a constant high turnover of cells. The gut's one, okay, all of the replication's done in the crypts, which is why this hits the crypts so hard. But you can also find cells in particular stages of the cell cycle in lymph nodes. So you have lymphocytolysis. In the thymus and the bone marrow, we'll have enough cells in that population to maintain growth of this virus. At this point, it's not going to hit the cerebellum. It's not going to hit the heart. It's not going to hit other lesions that we might see replication in utero or just after birth. So it's going to be limited to your hematopoietic organs and your intestine. Slide number 2 is tissue from a horse. Can you give me a morphologic diagnosis and a cause? Okay, time's up. This is a great lesion, and we've all seen horse kidneys, and the cortex is way too dark. It's almost black here. The other thing I want you to notice is that the pelvis is reddish. Okay, it's not yellow. The animal's not icteric. Okay, but this animal is undergoing a hemolytic crisis. The lesion here, the condition would be called probably a hemoglobinuric nephrosis. Blue-black kidneys in a number of animal species. You want to think about the condition known as hemoglobinuric nephrosis. The morphologic diagnosis actually will be a diffuse acute tubular necrosis. This falls under the conditions of acute tubular necrosis. Now, this particular entity could be a number one of entities. Most of them are toxicities. The one I want you to think about in this particular case is something that's very specific to horses, and it is intoxication with red maple or Acer rubrum. A number of the other maples have toxic principles, but none cause the lesion as well or the fatal disease that you can see in horses. Happens in different times of the year. In the autumn, when these leaves fall off in high numbers, and if the horse is bored or just some reason has a fascination and eats a bunch of these leaves, you can have a per acute case with massive intravascular hemolysis. And you get lesions that look like this. The kidney is absolutely flooded with, well, there are two things that go on first. First, you have methemoglobin. There is a toxic principle in those red maple leaves known as gallic acid. There's probably a couple of other ones which denature the red blood cells and cause a tremendous Heinz body anemia. If you get enough of those, a little bit will cause a extravascular hemolysis. A lot of them will cause intravascular hemolysis, and then the kidney will be absolutely crushed by the amount of incoming hemoglobin. Now, in normal kidneys, yes, there is iron in hemoglobin. Iron can cause a little bit of damage, but in normal healthy kidneys, it really doesn't cause that much problem. The problem is that these animals are already severely anemic. The kidney is already ischemic because of the tremendous methemoglobin anemia. You have a combination of acute tubular necrosis due to ischemia and all of this hemoglobin going on. And it's a very bad combination and can kill these animals. Horses do not denature methemoglobin very well. They have a lactate-dependent way, which is very inefficient, and so they're very susceptible to this. Most other mammalian species have a true methemoglobinemia reductase, and they also use glutathione. But horses have a very poor way to denature methemoglobin, so it makes them a little bit more susceptible. And you get, with these severe intoxications, a combination of the methemoglobinemia, the anoxia and tissue ischemia from that, and then this flood of hemoglobin containing iron, and it causes a peracute toxicity and death in these animals. Now, there are other times of the year where they can eat the leaves that are not wilted, like they are in the fall, which have a lesser amount of the toxic principle, or they can get into other forms of maple, which will give them a methemoglobinemia, but their body can compensate for that. Okay, great lesion. Is this the only one that's going to cause blue-black kidneys? There are some other diseases, nitrate poisoning, possibly some forms of leptospira, and maybe some of the blood parasites like Babesia cabali or Anaplasma phagocytophilium have been reported in causing this. When I see something that is this blue-black, and the blood from this animal is going to be sort of a muddy brownish black color. When I see that, I'm going to think about red maple toxicity. Here's another fantastic picture. And a lot of these pictures over the years have made it into Noah's Archive, or I got them from Noah's Archive. And I love this picture ever since I first saw it. It takes me all the way back to veterinary school. This is tissue from a cat. Can you give me a morphologic diagnosis and name the disease? Okay, time's up. We're looking at multiple cross sections from the lung. And what we see is we see that the airways are outlined by this sort of whitish gelatinous material, which is a combination of submucosal gland hyperplasia and smooth hyperplasia, and a lot of them are filled with sort of a gooey material, which looks like mucin. And this is a condition known as feline asthma. It's a classic condition in cats. It's not the same as it is in people, but what it does, and back, if you remember all the way back to your vet school radiology, someone probably showed you a picture of these, and they said, look for donuts in the lungs of cats. And now we can see exactly what that is. Okay. And there's just tremendous smooth muscle. This is a disease that primarily affects the airways. And you have tremendous smooth muscle hyperplasia and submucosal gland hyperplasia causing these cuffs and outlining the airways. Feline asthma. Okay, slide number 4. We've had a couple of toughies. Let's throw you an easy one. Hopefully everyone has seen this lesion. Is tissue from a horse, and can you give me a morphologic diagnosis? Okay, time's up. I'm going to revise that question. I'm not going to ask you a morphologic diagnosis. I'm going to give you one. It's a little tricky. So I'm going to ask you to name the condition. And the name of this condition is hemomelasma ilii in horses. Doesn't always affect the ileum. You can see it all over the gut. Morphologic diagnosis. This is multifocal coalescing, serosal fibrosis, and siderosis. Okay, these are plaques, and they are plaques of iron. They are plaques of fibrous connective tissue, mineralization. There's calcium in here as well. Now this one is particularly red, has a little greenish tint. I've seen them be black, I've seen them be greenish. Because there is blood products within them, that blood's going to break down, it's going to give them some tinctorial change over time. Hemomelasma ilii is unique to the horse, and it's always been thought that it is a result of strongyle migration. Because strongyles live in the gut, we know that certain types of strongyles, like Strongylos equinus, will migrate through the peritoneum of the abdominal wall and flank and cause similar lesions. The difference is you can find the larva of Strongylos equinus in those lesions. No one's ever been able to dig one out of this. I really like the theory that Dr. Fabio Del Piero gave me many years ago on this. Rather than, say it's Strongylos vulgaris, which nobody's ever been able to prove, he said, the horse's gut is continually expanding and contracting. They get a lot of gas, it swells, then the gas passes. We have borborygmi and all the other things. And he believes that this is the residuum of marked swelling of the gut. You swell, you tear the blood vessels. If you have sort of massive localized swelling, you tear the blood vessels, you have hemorrhage, you get the hemosiderosis, the collagen. And I like that theory because so many of these animals that you still see it on are on great worming programs. And no one has ever been able to pull a migrating strongyle out of this. Strongylos vulgaris likes to migrate along the gut, but it does it on the inside. It does it in the mucosa, and it leaves little tiny tracts, but it doesn't cause this lesion. Hemomelasma ilii. Okay, we're moving on to slide number 5. Oh, we're back to horse. There's tissue from a foal. Can you give me the morphologic diagnosis, a cause, and associated clinical pathologic lesion? Okay, time's up. We are looking at the intestine. The intestine looks somewhat swollen. Normally it's not quite as rugose as this is. And I told you that this was a foal. This is about the time of the year that it's foaling season now in Kentucky. And in the fall, we're going to see a number of foals which have this particular condition. You can pick them out because between the ages of 6 months and 12 months, they're going to be growing slower than the others. They're going to be skinny. They're not putting on weight. And so you can pick them out of the field. And it's a very simple test on these animals. You can draw blood and look at protein levels because they are hypoproteinemic. Or you could simply run a fecal sample for PCR, and you're going to look for Lawsonia intracellulare. Lawsonia intracellulare, the causative agent of this particular disease, causes enteritis or colitis in a wide variety of species. It causes ileitis in hamsters and pigs, often a bloody ileitis. In ferrets, it causes a bloody and proliferative colitis. The other thing that is very characteristic of this is the proliferation. Lawsonia is an intracellular bacterium. Once it gets in cells, it sort of causes a proliferation of them. They don't differentiate truly, and so you can tell them. In some species, you get a very glandular proliferation, and especially in pigs, hamsters, and ferrets. Okay, it does affect a number of other species. In horses, especially foals, it causes a mildly proliferative enteritis, given this sort of cerebriform nature, and a histiocytic enteritis. So my morphologic diagnosis is going to be proliferative and histiocytic enteritis or ileitis in this animal. And the clinical pathologic change is going to be simply hypoproteinemia. These animals lose a lot of protein from their gut, and this is something that is repeatable and measurable. Rabbits are somewhat similar. They do get an enteritis. They get a histiocytic enteritis. Their histiocytic enteritis is a little more severe than what we see in other species, and they don't tend to get the necrosis as much. So Lawsonia intracellulare in foals is a disease you absolutely need to know about. Slide number 6 is tissue from an ox. Can you give me a morphologic diagnosis and a cause? Okay, time's up. This one's a little red, but hopefully you know where we are. We're looking at the leaves of the abomasum, and the mucosa throughout the abomasum has this very distinct appearance, which is caused by the proliferation of epithelium into sort of these fine nodular form. People have called this Moroccan leather. If you've ever seen Moroccan leather, it's this beautiful pattern to it. This is a condition that is caused by a trichostrongyle, which lives on the surface of the gut. It doesn't really cause a lot of problems in terms of sucking blood. Animals don't become anemic. But because it wiggles and jiggles and tickles on the surface of this gut, you get a tremendous proliferation of the mucosal epithelium. It forms these nodular aggregates. My morphologic diagnosis on this is going to be a diffuse proliferative abomasitis. If you want to make a longer one, you could say diffuse abomasal mucosal epithelial hyperplasia and hypertrophy. And that's fine too. It says the same thing. What I don't want you to say is eosinophilic abomasitis, because these worms do not attach. The body doesn't really know what's there except it's sitting on the surface. If you wanted to go and say it's a proliferative and catarrhal abomasitis, that'd be even better. A lot of what's proliferating here are mucous neck cells, and catarrhal is a great descriptor for when you have worms that just sit on a mucosal surface. They live there, they don't do a lot of damage, they don't attach, they don't incite a systemic response. And catarrhal doesn't mean just mucus, it's a combination of mucus, degenerative epithelial cells, maybe a couple of neutrophils and eosinophils. It's a great term given to me 40 years ago by Dr. Paul Stromberg, and I have used it for this type of inflammation ever since. The agent, as we said before, is Ostratagia ostratagia. You could also have Ostratagia circumcincta in small ruminants, and it's very small. If we look very, very closely, we could probably see it, but it's a trichostrongyle, also known from the Latin for hair worm, so it's a tiny thing. Slide number 7 is tissue from a horse. Can you give me a morphologic diagnosis? Okay, time's up. Now, if you haven't seen a slide like this before, it can be a little tricky the first time, but this is a pretty common lesion in old horses. And we're looking at something that's irregularly round, sort of brick-colored, finely vacuolated surface, and not a lot of fat around it. It's always a lymph node. It's not really a lymph node. This is a bisected equine thyroid gland, which sort of explains everything, including the color. All of these little fine sort of cyst-like structures are probably follicles. And this is an older horse. And what we have are two well-demarcated neoplasms within the parenchyma of the thyroid gland. These are not the parathyroid glands. These are neoplasms. Now, if you look at the old literature, everything before the age of immunohistochemistry, people used to say these are follicular adenomas, very common in old horses. Okay, follicular adenoma. Okay, then immunohistochemistry came along in the late 90s, early 2000s, and people were still so accustomed to calling these follicular adenomas. They often had follicular-like structures, some of them had incipient follicles, all the morphologic markers of follicular neoplasms. Well, then people started actually putting immunohistochemistry. And believe it or not, the majority of my experience, now that I put a lot of immunohistochemistry on them when I get them, is that these are not follicular in origin, but they are C-cell tumors. They are benign. They don't metastasize, okay? But they do light up for C-cell tumors. They are synaptophysin positive. You know, it probably doesn't make any difference. They don't do anything, but it just shows you that some of the older literature can be wrong and not to believe everything that you do. So I routinely run immunohistochemistry on this, and I have a lot more C cells now than I did in the past. So run it yourself. Don't believe me. Don't believe anything I say. Run it yourself, and then you let me know if you come out with more follicular or thyroglobulin positive cells than C cells. Okay, slide number 8 is tissue from a dog, and a great advertisement for wearing gloves. Okay, time's up. Now, this person wasn't wearing gloves. That's okay. Might want to clean his or her fingernails too. That's okay too. And he's not going to catch this from this dog. But we do tend to wear PPE when we can. We're looking at the penis of this dog and the sheath or the prepuce. The morphologic diagnosis on this is penile and preputial transmissible venereal tumor. The transmissible venereal tumor is a really unique and interesting neoplasm of the dog. And it's unique for a number of reasons. One is one of the few xenotransplantable tumors. We consider them not contagious. This is a contagious tumor, and it can transmit to another animal by coitus. Another animal can come up and sniff this dog right there and transmit it to the nasal mucosa, so it can go between animals. There are very few transmissible tumors out there, with the exception, one of them a mammalian one, which is the facial tumor of the Tasmanian devil. Then most of them are down in bivalves and invertebrates. So let's get back to what else makes this an interesting. Okay, these tumors don't last long. They tend to regress. They are composed of dedifferentiated histiocytes. Okay, instead of having a normal chromosome number of 72, they only have 59. When they are in this stage, they tend not to express MHC2 genes. Actually, they express just a little bit. If you express too much, the body's going to recognize this tumor as being foreign and take care of it. If you express none at all, the body's going to recognize this as foreign and take care of it. But during the initial phase of colonization and transmission, it markedly decreases expression of MHC2 antigens. Now, over time, as the tumors get bigger, they express more and more, and eventually, the body's going to go after them, and these are going to disappear in the vast majority of animals. Sort of unusual to see them in the skin, and then every once in a while, in animals that are immunosuppressed, they just go crazy, take over the skin. They can go systemic, and actually be lethal. But that's really uncommon, and most of these particular tumors don't go that route. They eventually will be recognized for the body and taken care of. Slide number 9 is also tissue from a dog. Can you give me a morphologic diagnosis? Okay, time's up. It's a great picture. We're looking at the base of the heart. Here are the lungs. Here is the esophagus, and here is a fibrous band, which is actually the ligamentum arteriosum. This is something that is a congenital defect in some dogs, and you'll hear it referred to as a persistent right aortic arch. I prefer the term vascular ring anomaly, because then I don't have to get into the very long explanation of what a persistent right aortic arch is. But I will here. The other thing that is part of morphologic diagnosis and you cannot leave out is this very dilated proximal esophagus. So we have a vascular ring anomaly with megaesophagus. You can say persistent right aortic arch with megaesophagus. You got to have both of them for full credit. The esophagus back here is in pretty good shape. Everything up here is dilated because it has been constricted, because this ligamentum arteriosum forms one side of a triangle along with the base of the pulmonary artery and the aorta, that when the aorta, which normally comes, if we're looking at the front end of the dog, normally the aorta comes in and goes to the left. If it goes opposite and it goes to the right, then it twists everything and pulls this ligamentum arteriosum tight over the top of the megaesophagus, causing dilation of the megaesophagus. These animals obviously have significant problems with swallowing. So that's your vascular ring anomaly. Ligamentum arteriosum, the pulmonary artery, and the aorta. And they will form a constriction when the aorta comes in from the right. I just ignore all that. I just say vascular ring anomaly with megaesophagus. That way you don't have to explain it. Okay, finally, this is tissue from a goat. Can you give me a morphologic diagnosis? Okay, time's up. If you post old goats, not old goats like me, but actual goats, okay, if you work out in an agricultural area, chances are you get a couple of goats a week. And a lot of times these goats will be old. They may have been on a sort of bad plan of nutrition because people, for some reason, seem to think, A, that goats can eat anything, including paper and old tires or whatever. They put them out on the worst type of forage. Okay. B, goats, not as bad as sheep, but old goats tend to have tooth problems. So, and people don't give them a lot of dental care, so they can be starving even if they have decent forage. And 3, people just find it easier, unfortunately, to get a new goat than to provide good veterinary care. So what happens is you get a lot of old, maybe not so old goat, but goats that are skinny. They are parasitized. They may have tooth problems, okay? And they have diffuse, severe serous atrophy of fat. They have resorbed all of their fat stores. You can just about pour their bone marrow out into a cup. And one of the places that is very significant is around the coronary arteries of these goats. But anywhere that you used to have fat, in the mesentery, whatever, you will find this sort of watery yellow material. And I call this, for my residents, I call this the melting goat syndrome. Because you open the goat, it looks like it's melting inside. But it's just this tremendous serous atrophy of fat from malnutrition, starvation, age, and poor veterinary care. I'm not that interested in these hemorrhages on the surface of the heart. They're usually agonal. I don't know how this animal died, but it's a really nice slide here of one component of the melting goat syndrome. I've had residents that, without looking at the growths, they might have received these slides as part of an necropsy in a jar, and they want to call these myxomas because there's such degeneration. There's almost no recognizable fat. It's all this bluish material. Whenever I hear somebody talk about myxoma in the heart of the goat, it's like, back up. Let's go back to the gross lesions and see if this wasn't just a starving, malnourished animal. Melting syndrome of goats, that's my name for diffuse severe serous atrophy of fat. And that brings us to the end of today's Growth Path Challenge. I hope you've enjoyed it. I hope that you're getting something out of these lectures, and it's making your sheltering in place a little more profitable for your knowledge bank, and gives you something to do for at least 30 minutes a day. It certainly helps me. Well, thank you again. We will see you tomorrow for another Growth Path Challenge, Growth Path Challenge number 66. Say goodbye, Finn. Goodbye, Finn.